Welcome to Rheumer Has It, the podcast that busts myths, highlights evidence, and inspires hope for living better with rheumatic disease.
Through plain language discussions and interviews with experts, we offer actual knowledge so you can thrive today.
My name is Eileen.
And my name is Cheryl.
Join us as we bust myths and spotlight evidence.
Yay! So today we're going to be sharing the most exciting things we learned at the ACR, American College of Rheumatology's annual conference or annual convergence meeting. But before we do that, we want to share a little bit about why this conference and meeting is so important.
Well, this conference is important because it is the largest rheumatology conference in the world next to the European one for EULAR. EULAR stands for the European Alliance of Associations for Rheumatology. And so at these conferences, particularly ACR and EULAR, of course, they have about thousands and thousands of rheumatology professionals from all over the world. And we're not just talking rheumatologists or researchers, but there's pharmaceutical companies. There's was many occupational therapists, physical therapists, social workers, organizations like the International Foundation of Autoimmune and Autoinflammatory Arthritis was there. There was gout organizations, scleroderma organizations, Sjogren's organizations, lupus organizations, and so many. And so it's like the biggest event for people involved in rheumatology to get together and connect, learn, mingle, network. There's all sorts of things that are going on. And it was really exciting for me to go because I'm a patient, I'm not an academic. So having to get to these conferences is a little bit harder for me to get there. I was there because I was speaking this year and I have spoken a couple years before. And yeah, so this was my 7th ACR as well. And I've been to a few. They typically take place in a major city throughout the US each year. I've been to Washington, Philadelphia, San Diego, Atlanta, and next year is Orlando. Patients get there through either speaking opportunities. This is usually with a research project or an organization they might be partnered with, and that's including a sponsorship, or sometimes they get a patient perspective submitted and accepted. And these are abstracts and posters that patients can put together, and they get about 2 hours in the big poster hall to talk to everybody about whatever they decided to write about. I've done 3, one on patient engagement and research, support groups, and how much I love the sauna. So it is probably one of my absolute favorite events of the year. And I'm going to hand it over to Cheryl now to talk about some of the sessions that we did together.
Yes, this episode is really going to focus on what we found as rheumatoid arthritis patients and as patient educators. We're going to talk about what we found the most exciting and some of the most buzzworthy developments. But first, we wanted to let you know a little bit about the sessions that we spoke on. So together we spoke on ways to improve patient health literacy. And honestly, that's the purpose of this podcast. And health literacy is just literacy is being able to understand the spoken and written word, and health literacy is understanding information about your health and healthcare. And we talked a lot about misinformation, ways to help combat that. And one of the takeaways I found, because I dug really deep into the health psychology research, is that people don't change their minds when presented with facts. They change their mind when presented with stories and emotions, which is kind of the opposite for me as an occupational therapist, how health providers are trained. We're trained to be unbiased and not overly emotional and not rely on personal anecdotes. So there was a lot of like paradoxes there that we delved into, and that was really great. And then the second one was a support group technology session where the 2 big takeaways I would say. One is we really wanted to get a diverse group together. So we had one Latina speaker and one African American speaker. And they talked a lot about how the importance of support groups for meeting people's needs with marginalized identities, whether that's through sexual orientation or through racial background. And we also talked about how technologies like social media can increase your access to populations that might not come to an in-person support group due to many barriers. The second one, this is a little bit more academic, but from my side, I wanted to look at the research into are virtual support groups as effective as in-person support groups? And one thing I found really exciting was that yes, they are. So that was very heartening to me as somebody who's led support groups for rheumatoid arthritis for the last 5 years and developed my entire business is support programs and educational programs. That was awesome. So yeah, Eileen, why don't you talk about the one that you did that we weren't together on?
Yeah, so I was invited to speak about patient engagement in research, the best practices. So I really wanted to focus on tokenism and power imbalances. And I gave some personal stories, not just facts, but personal stories
Mhm.
about how tokenism and power imbalance, when I have been a patient partner in research, has affected me as a patient partner in research and also personally. Unfortunately, my talk did get cut short a little bit because we were over time, so I didn't get to finish it, and I worked really hard on it. So that was a bit unfortunate, but it does happen. It just kind of taught me a lesson. Make sure we keep on time. And the other session that I was involved in was on shared decision making with a rheumatologist or two rheumatologists, one from the UK, one from the US, and then a Canadian occupational therapist who has developed a child's arthritis decision aid. And they were just talking about how shared decision making has helped patients make decisions easier and it's helped rheumatologists talk to their patients easier and how having that visual with the cards that they make or the pamphlets that they make for these aids can really help patients kind of conceptualize everything because when they're being told to start medications it's really overwhelming. So it was interesting to hear from I know from my personal experience shared decision making is huge because gives me the preference of what medications I want, how when I want to take it, and things like that. However, I hadn't really heard from the rheumatologist perspective what the advances were for that. So yeah,
Yeah.
it was really exciting to speak, and it's one of my favorite things to do. And hopefully, we're doing it again next year.
Yes, yes, we have some proposals in the works. So now we're going to go into our biggest takeaways from other people's sessions. I went to 3 that have to do with either dietary interventions and or the microbiome. Those do go hand in hand because dietary interventions affect your microbiome. And if you don't know, the microbiome is like the series of little bacteria that live in not just in your stomach, but actually in your entire digestive tract. So from your mouth to your butt, to all sorts of bacteria in every single stage of the way. And people with rheumatoid arthritis have alterations in their gut microbiome compared to non-arthritis people. The problem is that causal, we don't know what causes what, right? But that's what all these researchers are trying to figure out. So the first one was Dr. Nisha Manek, who is a integrative rheumatologist in Loma Linda, California. She spoke on the topic of diet supplements and stress reduction for rheumatoid arthritis specifically. And if you look into dietary interventions for rheumatoid arthritis, you'll hear this over and over and over again. A plant-focused Mediterranean-style diet with lots of diversity of vegetables, fruits, whole grains, nuts, seeds, olive oil, moderate fish and poultry, and avoiding highly processed food is really what's recommended over and over again to help reduce inflammation and support a healthier gut microbiome. She also did talk about supplements, which is a little bit of a controversial thing because the supplements that are marketed specifically for arthritis are not endorsed by the American College of Rheumatology. However, there are general supplements like vitamin D that when you are deficient in them and you have rheumatoid arthritis can be particularly bad. So she highlighted the importance of making sure you have enough vitamin D, which I know Eileen and I both live in rainy, cold areas. So I do take a vitamin D supplement just as a patient testimonial or whatnot. And
I do too.
yeah, and also she showed some evidence of supplements for like fish oil and turmeric, but they should not and will not replace your prescribed RA treatments as your expectation. The third thing that she said was managing stress, sleep, and the nervous system is often looked, but also important part of controlling inflammation, which is very understandable. The second one I went on that looked at nutrition for rheumatic disease was by Dr. Brian Andonian, who we became the biggest fangirls of. He was a great speaker, and he was going to be on the next episode of the Rheumer Has It podcast. So we're not going to talk too long about his stuff, but what he taught me that I had never really understood is that rheumatoid arthritis, the disease itself, leads to accelerated aging throughout the lifespan. I knew we had a shorter lifespan, but I didn't know that throughout the whole lifespan, it was accelerated. I thought it was maybe just towards the end. So that's the bad news. But the good news is that we can slow that accelerated aging down and prolong our lifespan through exercise, diet, and sleep. So stay tuned to hear more about that. The last quick one was that the microbiome specific research, the gut microbiome shows that your gut microbiome might affect how likely you are to respond well to methotrexate. So people who responded well to methotrexate, which I fall in that category where it helps control my disease, those people had a different gut microbiome profile compared to those who didn't respond well to methotrexate. So what is going on there, the scientists don't know yet, but the conclusion they made was maybe by altering the gut microbiome in the future, they can predict better who can benefit from certain RA drugs and possibly improve treatment outcomes. So that was really exciting. So what was one that you really wanted to highlight, Eileen?
Well, I think the one that I want to highlight, because I noticed there was more talk on it than usual, was mental health and fatigue. And I know that that is also a hot topic for patients. So this one that really stood out to me was talking about grief and how people with rheumatic diseases they do go through grief, especially at the beginning of the diagnosis, but then also throughout their diagnosis. And they were kind of highlighting how important it is for rheumatologists to watch for this and refer patients for mental health support, because when the grief turns chronic and it doesn't stop, that's when it turns into depression. And that's when medications are needed, more interventions. So it's really important for rheumatologists to recognize that rheumatic disease, there's so many losses, and patients will go through all the different stages of grief, the denial, anger, bargaining, depression, and then hopefully they reach acceptance. And it's really good for rheumatologists to help patients get into the area where they are accepting what's happening to them. I went to one session that was speaking about grief and then how the patients do not get adequate support for mental health, which is interesting because I was actually involved in a study with Arthritis Research Canada on that. And they actually, a couple times I saw the study was cited. So it was interesting because that was a Canadian study, but it's also reflective across the US and I guess, among other countries. So it was definitely highlighted that mental health needs more guidance for patients. But then they also went into about how the benefits of lifestyle medicine can actually really help patients with their mental health. And they were talking about whole food, plant predominant nutrition. Again, that was a common theme I heard throughout the conference. Sleep was also brought up quite a few times. And then exercise. Exercise was brought up a lot, especially as being the only highly recommended treatment on the integrated treatment guidelines for rheumatoid arthritis that were released in 2022 by the American College of Rheumatology, and which I was also involved on, especially seeing how it has helped shape the care for our diseases and how important integrated treatments are. So one of the things that there was highlighting was the Plants for Joint study, which showed significant improvements in pain and function for those living with rheumatoid arthritis, and how that helped even reduce some of their medications. And that was quite interesting. So I can't remember if they went on to like the mental health medications or if it was anti-inflammatory medications. But as somebody who has to take both medications for my rheumatoid arthritis and my mental health, I would love to significantly reduce either of them. And one thing that they also highlighted was the people with rheumatic diseases and depression, they have a stronger chance of having fatigue and having really bad fatigue, almost like treatment resistant fatigue. And when patients have poor sleep, that's also another indicator that their fatigue is really bad. They have more anxiety, they have more depression. And so they were kind of highlighting how symptoms like poor sleep and lack of proper nutrition, lack of physical activity, and lack of like mental health support has kind of turned into more poor outcomes for patients, and how there needs to be interventions outside of just medications. However, there was one really cool lady who was speaking, she was a psychiatrist and a rheumatologist, and she went through all the medications that are SSRIs or SNRIs that can help patients and how they help them. That was more for the rheumatologists to kind of understand, but it was really interesting to see how she has seen changes in her patients' inflammation after improving their mental health as well, and the role that medications do have in that. Some medications like Celebrex can actually help patients not just for their mental health, but reduce nerve pain and pain and fibromyalgia. So that was, I thought that was extremely interesting to me. So you learned about some new treatment, one that's
Yes.
really, really popular with patients right now.
Yes, yes, and I think a lot of us the word I'll say this, the word cure is not something that I've heard a lot of researchers use until CAR T cell therapy has come around. So CAR T cell therapy stands for chimeric antigen receptor T cell therapy. It is something that has been used in cancer for a while. And what it does is, and this is again, you might see, we've taught you to not listen to words like this, like reboot your immune system when it comes from somebody trying to sell you a supplement. But this actually is literally happening in CAR T cell therapy. A lot of the studies have been done on lupus to lead to a deep remission without the ongoing steroids or immunosuppressants. And I interviewed a researcher for my regular podcast, which it'll come out soon, Kayla. And she said it's the first time she's heard lots of rheumatologists using the C word, like cure. And if you remember back when I interviewed the Benaroya Research Institute, the head of that, she said a couple years ago, I said, "Do you think there's going to be a cure for rheumatoid arthritis in my lifetime?" And and she said, "I think there's going to be a cure for rheumatoid arthritis in the next 15 years." And I was like, "Whoa, I had never heard anyone say that before." But now I know she meant CAR T cell therapy. Now you're like, "Okay, this is too good to be true. How do I get it?" Because this is a reboot where you would not need ongoing therapy, not need ongoing medications. It's like a one and done thing, as far as I understand. However, here's all the disclaimers. A, it's still experimental, not done on a lot of people with rheumatoid arthritis yet. Obviously, there are potential side effects. The traditional CAR T cell therapy is intense, requires chemo-like preparation and close hospital monitoring. However, there is a new approach that some people were presenting at the conference called CAR Tregs, Tregs, that's gentler. But again, it's very early on. You cannot get this therapy anywhere other than a clinical trial. And the actual cost of this treatment is, I'm not exaggerating, over $500,000. So that's the big question, is who's going to pay for this? And also, it hasn't been around long enough for us to know the long-term safety implications for it. So it is, again, not something you can get currently, but maybe keep an eye out for it over the next few years. And there actually is a clinical trial enrolling in Seattle, Washington right now. If you're interested, I can let you know the names of the people doing that. The second one that could lead to a long-term remission, vagus nerve stimulation therapies, vagus nerve modulators, they can lead to a long-term unmedicated remission. However, you still need to have the stimulator on you. So it's like in some ways getting a pacemaker. But it's not in your heart. It stimulates your vagus nerve. It's in your neck. And what it does, it's the abstract where this was presented was called Neuroimmune Modulation for the Treatment of Rheumatoid Arthritis, results at 12 months from a randomized sham-controlled double-blind study. So it showed that once daily cervical vagus nerve stimulation kept about half of the difficult to treat RA patients. It made them go into low disease activity or remission with a safety profile, again, more analogous to a pacemaker than to immunosuppression. So not only are these medication-free treatments, they are immunosuppression-free treatments. The 12-month reset RA data led to FDA approval in July 2025 of the set point system. Yeah, that's the first ever neuroimmune modulation vagus nerve stimulation device for moderately to severely active RA. So if you're interested in that, we're going to put links to all these studies in the show notes. So those were like the talk of the town, especially the CAR T cell, because it really could lead to a cure. But the other talk of the town is when you're going to talk about the GLP-1 type meds.
Yes. So I think this is probably one of the hottest topics other than CAR T at ACR this year, because the research around it is actually starting to sound really promising. And I have been hearing from a lot of patients who have tried GLP-1s, which are glucagon-like peptide 1. That was a mouthful. So I've also been involved in some research, but it has been as a patient partner, not a patient participant. And that was for rheumatoid arthritis patients with type 2 diabetes. And that has shown a great reduction in not just weight, but also their diabetes. So that's fantastic. But what if they don't have diabetes? Like, because diabetes is a common comorbidity or tag-along condition with rheumatoid arthritis. So what's a good way to prevent us from getting that? GLP-1s, right? So we want to know where the research is, and also some of our medications cause weight gain. So how do we get that prednisone weight gain off, right? Well, GLP-1s aren't just showing that they're good for weight loss. They're also showing that patients are having better heart health and longer life. They saw that people with RA or psoriatic arthritis face higher risk of heart disease. But 2 studies found that patients on GLP-1 drugs had fewer serious cardiovascular problems and lower death rates. In psoriatic arthritis, users had a reduced risk of major heart events and lower overall mortality compared to non-users. And in rheumatoid arthritis, obese patients without diabetes had an 86% lower risk of death and a 40% lower risk of major cardiovascular events, mainly fewer cases of heart failure, if they were on a GLP-1 therapy. And also, I think what we're wanting to know, does it make us feel better? Well, one study showed that it does show improved joint outcomes with RA in patients already diagnosed with RA. Those prescribed semaglutide reported fewer joint flares, including less stiffness, swelling, and pain. The benefits appear like within 30 days and lasted up to a year, though this is obviously an area that they need to have more research in, just like the vagus nerve stimulations and the CAR T therapies. So I think that's some of the information that patients really, really want to know about GLP-1s, semaglutide. These are known as Ozempic, Wegovy. There's probably some other brands as well. And when we have research like this, we need to advocate so that it can get covered by insurance, so that it can help support patients who don't just have type 2 diabetes, because this is also prevention for major comorbidities of rheumatic diseases like heart disease is a huge one, hypertension, diabetes, obesity. So yeah, it's looking really promising. I think this year, the highlighting of all these new therapies was probably one of the most exciting parts. Like, I've been there before, ACR, where they've had things about exercise, sleep, mental health, which is always exciting. It's very validating, but this really brings hope for us patients.
Yeah, and
Now,
I was just gonna add that I think the thing that's really exciting about the GLP-1s is that they're already on the market and they don't have as big of a cost barrier as things like CAR T cell, and they're not invasive. Like it's an injection as opposed to an implant. I mean, I'm pretty chill when it comes to surgeries or medications and stuff, but you get near my spinal cord, I'm gonna get a little bit nervous. And now the one downside, I'll say, as somebody with gastroparesis, I'm like definitely not a candidate for GLP-1s. I have a hard time keeping my weight up as it is. But one of the potential cautions that people are saying for rheumatoid arthritis specifically is that we are prone to muscle wasting. And sometimes, I don't know if they understand why or how, but the weight loss is coming from the muscle as well as the and I want to just make sure you're working to keep your muscle strength.
Yeah, I've heard recommendations to make sure you are strength training and to be eating lots of
Yes.
protein.
Per Perfect. So I'll keep an eye on that. But yeah, those were definitely amazing advancements. And I was listening to an interview with a different rheumatologist who after the conference, he made an interesting point. He said every 20 years around, we tend to have a huge leap in rheumatoid arthritis and rheumatic disease treatment. In the 80s, it was the conventional DMARDs like methotrexate. And then in the early 2000s, it was the biologics like TNF inhibitors like Enbrel, Humira, and then the other like IL-6 inhibitors and all these other meds that we all can be on now. And then now, like 20 years later, now we're having this new era with the CAR T cell therapy, GLPs, and the vagus nerve stimulation. So Yeah, I agree with you that having been to the conference numerous times, this was the first one where we're starting to feel like, ooh, we're getting some excitement here in terms of
Mhm.
a new
Absolutely.
era.
Yeah, but I was busy during a session that I really wanted to go to because
Yeah.
I am so happy that this, aside from our session last year, was brought up, but you
Hmm.
got to see one on cognitive dysfunction, which
Yes.
hasn't really been talked about a lot. Please tell me about that one.
Yes. So the first thing I will say is if you feel like you're struggling with your thinking, that you feel this sense of quote unquote brain fog or a sense of I can't think clearly anymore, it's not you, it's the disease. Like you're not just imagining it. It's amazing how few rheumatologists actually know about this and monitor for it, given how many studies there are that do show this is a very reliable, predictable phenomenon. I was having a little bit of an existential crisis listening to this. Like, study after study shows that people with rheumatoid arthritis and similar rheumatic diseases, they did a lot on scleroderma and fibromyalgia as well, have cognitive dysfunction. Like, we perform worse on some tests of cognition. Now, cognitive function is not just one thing. When you look at cognitive testing, it's broken up into many different subdomains. So one that is shown a lot is short-term memory problems. That's one. Difficulties with concentration and focus. There can be difficulties with verbal fluency and language problems, difficulties with processing speed. I definitely have the next one, which is decreased executive function. So your executive functions are like the CEO of your brain or like the conductor of the orchestra of all your other higher level functions in your frontal lobes. So just know that people with RA, fibromyalgia, and scleroderma consistently show cognitive dysfunction among multiple domains. You're not alone. Now, what can you do about it? So unfortunately, the program that they talked about is not widely available. It's available only to people enrolled in this study, but hopefully in the future they want to make it available. It's out of University of Michigan, and these researchers took exercises and activities that are very common in what we call neurorehabilitation or brain rehabilitation. Now, I learned brain rehabilitation tools as an occupational therapist for things like traumatic brain injuries or strokes, and I think it's brilliant to say, okay, if someone has some cognitive dysfunction, whether it's from a brain injury or stroke, or let's say rheumatoid arthritis, let's use those same techniques. So there's really two buckets. There's they call them cognitive compensatory strategies, which is, okay, if we can't fix the underlying cognitive dysfunction, let's put scaffolds and external things to help the person function better. So a simple one would be if you can't remember, like let's say, well, you always put a timer on or a reminder on for my medication. Every single day I have a reminder. I'm not going to rely on my memory to 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 remind me to take the medication. I have to have a reminder. So technology reminders. Another one would be attention strategies would be like breaking complex tasks down into smaller steps, pacing yourself, organizational strategies, and those are all very common cognitive compensatory strategies. What they also did in this study was they looked at brain training games, which there are some that kind of sound kind of scammy out there, like play this game every day and you'll boost your brain. But actually, they did show that with people with scleroderma, that was the focus of this particular study. They did show improvements on their cognitive function, not only on standardized testing, because some of us can still do well on standardized testing, but struggle in everyday life. They also did better in everyday life when they had participated in this quote unquote brain boost program where again they were taught cognitive compensatory strategies and they participated in brain training games. So that was really exciting. It's like exercise for your brain. But they also, another speaker in this session did speak directly to the role of exercise, strength training, and cardio in particular on improving cognitive function. So that is one quick thing you could do today is get your body moving. That does improve cognitive functions. So yeah, that was a really great one. And I hope to see more on cognitive function in the future. There's another one we want to make sure, even though neither of us has Sjogren's, we want to put a little spotlight on Sjogren's. What did you learn about that?
Well, I think this year one really exciting thing was how prominent Sjogren's was everywhere. It was on buses, it was on elevators, it was on escalators. There was so much just awareness around Sjogren's. And that's because two major things have happened in the last little while. One, Sjogren's syndrome is no longer called Sjogren's syndrome. It's now Sjogren's disease, which is great. actually highlights that it is a disease and not just a syndrome, to hopefully taken more serious. And I think it is because now there are actual medications in the works coming out in the pipeline, medications specifically for Sjogren's. And that's fantastic news. Always when there's new medications coming out to treat us, any rheumatic disease, that is exciting. So yeah,
Yeah.
that's the big news about Sjogren's.
Yeah, and we mentioned earlier that we're also going to talk to Dr. Andonian about this lifestyle, how nutrition and exercise can help slow down that risk of accelerated aging. Is there anything else you wanted to say to whet their appetite on the let's get physical talk? We'll
Well,
leave it.
it's really exciting because he had like actual scientific evidence that exercise can help reduce inflammation, helps people even reduce medication, how it's helped their sleep, all these sorts of wonderful things that exercise is really kind of showing us. And I'm excited for that. And I'm really excited to bring Dr. Andonian on this podcast because I know whoever listens to this is going to be as much in love with him as we are because he is just a fantastic speaker
Yeah.
and you could just tell his passion for both physical activity and rheumatology.
Yeah. That is, I know we're a little bit over time, but I have to say that that is one of the best things about the conference. It's not just the things that we learn, because you can learn those without going to the conference physically, but it's just being in the presence of these really fantastic researchers, seeing people that are so passionate. I had a doctor from Oregon who stopped me after our talk on health literacy, and he was working on a model. He wanted to just pick my brain as a patient and as an OT and a patient educator. It was really, really creative, and just feeling that energy and feeling the excitement is really great. So anyway, on to our takeaways. So in one sentence, what's the most important takeaway we want people to take from this episode? I would say that better treatments are on the near horizon for rheumatoid arthritis that are less immunosuppressive than our current therapies, which is really, really exciting. What would you say?
I would say that symptoms, basically going back to our session last year of it's not just joint pain, those symptoms, that's extracurricular symptoms of rheumatic diseases are really starting to get noticed. And they're really starting to have studies involved and hopefully solutions for us.
Yeah, I love it. I love it. Well, thank you all again for listening to another episode of Rumor Has It. Don't forget to check the show notes for a full transcript, and especially for this episode, links to everything that we discussed. You can get that at www.myarthritislife.net.
Awesome. And we would also love to hear what you think about this episode, what you would like to hear again, or any topics you want us to cover. So send us an email or a comment on our social media accounts.
Thanks so much. Bye bye for now.